Hello everyone, Namaste. First of all, I would like to tell thanks to each and everyone for sharing and subscribing my channel. Thank you. I'm back with the second episode to talk about dysphagia and its signs and symptoms in general. Okay, before talking anything about dysphagia, I would like to talk about normal swallowing. What is normal swallowing? Whatever we eat, that is going to get divided into three phases. Basically, the oral phase, pharyngeal phase, which is at the throat level, and the esophageal phase, and the stem. Okay? Basically, here, what happens? The bolus will be getting masticated in the oral cavity, get blended, and then it passes down to the pharyngeal phase. And the pharyngeal phase will support the bolus to move down through the esophageal tube and then it get down into the stomach. So, the complete mechanism is like the food get blended in the oral cavity, the epiglottis will close the windpipe so that the bolus will pass into the pharyngeal phase and then from there to the esophagus and stomach. Okay, just remember one thing, your hand. Food will get blended in the oral cavity. It passes from the then the epiglottis will be closed and it moves the bolus to the pharyngeal cavity. Here the pharyngeal cavity will take the bolus and it passes from the esophagus tube and then it enters into your stomach. Got it? This is a normal mechanism. So what happens in dysphagia? Here the patients have difficulty in swallowing the food or inability to take the bolus from the oral cavity to the pharyngeal cavity or esophagus. It can happen with food or it can happen with liquids or it can happen with medicines. Here basically it can happen with any signs of symptoms like even the epiglottis may not close or the blended food cannot pass down from maybe quickly it get dropped down from the oral cavity to the pharynx or it may get delayed transformation from the oral cavity to the pharyngeal cavity. So even if the bolus is getting, there is a limited time, 0.1 second, it should get transferred the bolus from the oral cavity to the pharyngeal cavity. If it is like getting pre-spelled, then there is a chance of following the bolus from into the windpipe, or if it is getting delayed, also there is a chance of going into the windpipe. So if the food is entering into the windpipe, the patient may choke and cough, then it may lead to the aspiration. So, how do you identify whether the patient has dysphagia or not? Here I am going to talk about certain signs and symptoms of dysphagia, like the patient have inability to swallow the food, the patient may complain about food getting stuck in the throat, frequently coughing and choking, dryness in throat, difficulty in swallowing food, or feeling heaviness, drooling, choking, frequently taking water in order to clear his bolus from the oral cavity to the pharynx. In order to swallow the food, all the time you need to take the food, liquid, or feeling heaviness in the chest, feeling difficulty in respiratory issues whenever he's swallowing. Any of the signs if you notice, any of the signs if you see any of the people, then react that you identify that the patient is having dysphagia. So who can suffer with this dysphagia? Anyone, even normals. Almost research sees that 11% of normal populations are having dysphagia signs and 80% of stroke patients suffers with dysphagia, 80% of cancer patients will have dysphagia, 75% of respiratory patients have dysphagia. So, furthermore, in next episodes we'll be talking in detail like about dysphagia in stroke, dysphagia in respiratory patient, dysphagia in cancer patients and all. This session is only about in order to make you aware about what is dysphagia, what exactly happened or what are the signs and symptoms, that's it. Okay, so I am also sharing the links of videos of normal swallowing and what exactly happened in the patient with dysphagia. How does the aspiration takes place with the in the below description. So you can watch down the videos, and whatever have been explained you over here, everything you can compare with the videos and check about it. If you have any sort of doubts, you can comment in the comment section. Till then, now it's your responsibility to share and subscribe with other people so that it can help at least one. And also wait till the weekend for the new topic. Till then, bye, take care, have a good health. Namaste.